Good afternoon and welcome everyone who's on the other side. Unfortunately, I can't see any of you, but due to the amount of interest, that's the best way we want to handle this. So very warm welcome to everybody this afternoon to our information event on the recruitment of the posts. What we will do today, just go to the next slide. It's myself, Anushka Müller, Director for Improvement and Innovation, leading this directorate, and I've got Joe Pointer with me, who you will see a little bit later on video as well. And Joe and I will talk you through today a bit around what the Health and Community Services Department is, what the Improvement and Innovation team is about, what we do and what the team functions are, but also where the posts sit and what the function is of the post. So I think that will be quite useful because the job description is always quite generic, and it hopefully will be interesting to see how this all works together. And then we also will give you a bit of an update and context on the Jersey Care model. Really exciting program of work over the next 5 years. So as it is quite complex, but also actually very straightforward, we thought we'd give you some examples, what it means and how the roles play into that. And last but not least, we will give you an update on what the recruitment process will look like. And then we will have time for questions. So you hopefully will see you have the option to ask questions to us. So don't worry if you can't see them popping up straight away. There is a bit of a process. We need to make them live, but we do that as quickly as possible. So if you have any questions in between, just post them and we will come back to them at the end and do our best to answer them. Okay, good, then let's start, and I'll hand over, not this part, sorry. You see, we've just organized it so well, and actually I'm going to start on the introduction. So where we are with Health and Community Services, a bit of introduction to the department. It's part of the government of Jersey, and it's the largest department in all of the government. Quite a number of employees. We have over 2,500 employees, and the department serves a lot of the islanders across a number of services. So you have social care services, which some of you may not be aware of it. We have a lot of services in the community, but also then very dominantly, and I think a lot in the press, of course, we have the hospital, and that includes emergency care, but also maternity services. Commissioning non-government organizations, we do that as well, and we'll see that as a part of our team. For example, working a lot with community services, the hospice and family nursing together. And we do, of course, education of medical professionals and nursing professionals. So that's a very exciting part as well. And a number of other services. It's a really large department, but also very interesting to get into that. So who heads up the department and who are the people involved? We thought that might be quite useful. The government of Jersey is led ministerially, overall, and our Minister for Health and Social Services is Deputy Richard Reynolds, and we have 2 assistant ministers, as you can see. And then from an officer's side, the department is led by the Director General, Caroline Landon, and supporting her is the senior team, the Chief Nurse Rose, the Medical Director Patrick Armstrong, and the Group Managing Director Rob Sainsbury's, and of course you see myself here as well. So about my directorate, we are the Improvement and Innovation team, and it's a newly formed directorate. So we've just redesigned it, looked at what we are offering, was a team in place, and we've had a lot of opportunities are ahead with the Jersey Care model. And what we came up with was a very passionate team around change, not professionals actually, but change managers. And for us, the purpose is really to be not just a supporting department, but also a driving department. And our focus is to enable and drive effective and efficient business management. And we'll come to that in a moment, what that means. To do continuous improvement, with the person-centered approach and very productive working with partners. So these are very important components for achieving high quality care, and we look at what that means a bit more in detail, how we actually achieve that. So what you see here are the teams across my directorate. And you will see some of the roles. You can immediately see how they fit into these teams. So we start on the left-hand side. So we talked about good business management. On the left-hand side, we've got the team for strategic planning and reporting, and that's very much around having a business plan in place, knowing what the objectives are for the department, and working a lot with the care groups across the department. So as we just talked about the services, we have care groups, for example, for emergency services, then more the scheduled services, for community services, that includes mental health, adult social care, but also for services for women and children. So this planning and reporting function is very much there to create business plans, to work with the care groups, to help them to identify what their objectives are, and also leading at department-wide on the excuse me, to lead on the departmental business plan, which is a key function to make the overarching government plan work. So that department works a lot across the department, but also across the government. We have a number of more governance items that this team works with as well. These are the annual report and accounts, the government plan, as I mentioned, but also scrutiny, audit, and other recommendations for improvement. So keeping a good eye on that and making sure recommendations are being followed. The second team is the Portfolio Change Management Office. So as the title is saying, it's a team which very much looks at our portfolio of change. And it provides the holistic overview of all change, which is really, really important. So the team have created that work, and now they're going into identifying key projects for the Jersey Care model and driving these for the next 5 years. We have also a function, as you may have seen, the Intelligent Client function for digital health, which sits kind of attached to this team, but is an independent function. And that's really important because we have our digital health agenda, which is led by the central IT team, by Modernisation and Digital, so that doesn't sit within the health department, but this role is very important to provide that link to the M&D department, and also the link to our clinicians, so understanding what the digital needs are, what the opportunities are, and making sure projects are running smoothly from both sides. Then a very new function and a very exciting function is our quality improvement function. Quality improvement is a very health-specific improvement tool approach, and you may have heard about other improvement tools like different approaches to that. Quality improvement in health is a very holistic, wide-ranging approach, and we really want to establish here a good quality improvement culture. I'm looking at having established a training program for the department where everyone can understand what quality improvement is and is being supported to do quality improvement projects. So that will be a key part of the Jersey Care model as well. Commissioning and contract management, the fourth team. As I said before, we have a lot of services we provide ourselves, but of course there are a lot of providers on the island, from private providers up to a lot of charities who provide really valuable services. And at the moment we have probably not the most sophisticated approach in place, how we work together. So this team will look at how we can work really well together, how we can ensure we achieve the best for islanders with the resources that are available, and doing that, supporting charities and the sector that is working outside of the health department. And last but not least, our very important the HCS Business Intelligence team. So that's our, as it says, very important intelligence, but it's a wider intelligence team. It's also the informatics team. So this team provides the operational information for all services, but it also helps really developing that digital agenda and making sure we constantly innovate with how we use data, how we drive improvement. So the key theme here in terms of improvement, as you may have seen, is about making sure we identify improvement areas, we provide the best for islanders and support the services, the front line, to actually make these happen. Yes, I think that's all on these. So you have a look at the structure chart, which hopefully you can see the color coding. We try to keep that to the functions I've just gone through. And you can see at the moment on this structure chart the posts that are already in place and people already in place in these functions. So you see when we go through in a moment the available posts, it's a small team that is in place, but we've already covered a little bit of everything in each team, but we need to increase these. So if we go to the next slide, kind of next movement, let's see now, it comes up. And you see this is our final structure, and these are all the posts which have just popped up, which are currently advertised. Not all of them are actually currently advertised. The head of commissioning and partnerships needs to go through a few hurdles here at our end, administrative hurdles. The same is applies to the JCM engagement managers and the JCM secretary role. But apart from these three roles, everything else has been advertised. So you can see, sorry, quickly go back. Yeah, great. So you can see how this fits against our team structure. So that's really important. To each team has a number of resources and a number of different grades, which enables also a career development, which is important, and very much working together. So what this team and what we have currently already in place, we are very, very good at working with each other. We are very good at sharing information, and there's a huge ambition around improvement of the team itself. So how can we learn more? How can we develop each other? How can we come up with new ideas? So we do regular away days, we do a lot of team meetings, and we're now moving really into this, how do we learn more rather than doing constant operational, catching up. So it's a team that's very much focused on developing new ideas and helping the business to implement improvement areas. Okay, I'll hand it over to Joe, who will now talk through the Jersey Care model, because that is a key part for our team and it's our core purpose to deliver this new exciting model of care. Thank you.
Thank you. So why now? Why are we growing our team now? What's the opportunity? And as Anushka says, it's a really exciting time because we're introducing this new model of care, the Jersey Care model. It's a very ambitious model to take us from where we've been, but to transform our health and social care services to meet the needs of islanders. And it's their health and their care and their physical and their well-being needs, including both physical and mental health. And that's really important that we see those two things together and side by side. It adopts a person-centred approach, an approach which takes us away from being led by services, by delivering what suits the hospital, but to an approach where we put the person, the patient, the family carer, the individual needing support at home, right at the centre. And by doing that, we create a financially sustainable but safe and accessible services delivered where people need them. So they're in the right place, in the person's home, close to the person's home, in the community, and delivered at the right time. And they're really key elements that we do the right care in the right place at the right time. And the Jersey Care model is the And on top of that, it helps us to improve the physical and mental health by utilising all the advances that are out there, advances in technology, advances that enable people to look after their own health, and all sorts of things that we can do outside of the hospital that are now becoming available. So the objectives of the care model are this notion of person-centeredness, a focus on prevention, on people having the right education, and Anushka spoke a lot about education inside the service, but the right education to look after their own health, and that they control when they have care, how they have care, how that's provided. In doing that, we reduce dependency on secondary care services, on the more institutionalised type services, and we expand those primary and community services that are available. And Anushka spoke a lot about commissioning and working in partnership with our partners in the community. So we're looking at new models of commissioning so that we can really enhance the partnerships that are already here in Jersey. And in doing so, we redesign that health and community services so it's structured to meet the current and, really importantly, the future needs of islanders. We need to be ready for this population that we know is growing and is ageing, that we can meet all their needs now and into the future. So I've described slightly the current state, but at the moment, and some of you may have seen this in previous consultation exercises, we have a big focus on hospital care, care home care, quite a dependency model that we're dependent on people caring for us. We have a lack of coordination between our primary care services, our secondary care services, our home care services, our care home services. We often work in isolation in a separate way. We've got limitations in our preventive offer. We haven't got really strong preventative care services there. We have some bespoke screening, but again, they quite often sit in isolated areas and don't work together. And we've talked about integration and that we don't currently have this thing called parity or integration or equity across our mental health and our physical health services. And there's a paucity of services beyond 8 o'clock in Jersey. So you mustn't be ill after 8 o'clock. So we know that we're not providing good 24-hour services. So the aim is that by everyone joining us and having that team, we deliver this new model of care with people at the centre that are managing how and when and where they get their care, that there's parity across those care groups, that it's not a centralised function that happens in the hospital, but health happens wherever we are. We expand that care in the community, that primary and intermediate care. We become proactive. We prevent people getting ill. We become proactive in the community. We work with children early on so they understand health needs and how they stay well. We grow those partnerships, and there are partnerships, but we grow them, we strengthen them to be able to deliver these ambitions that we have, and that we utilise the technology that we've got now to its full potential, but we enhance that as new technology becomes available to us. So in introducing the Jersey care model, there has to be benefits. So the benefits to our islanders, to the citizens here, is that they remain healthy. Our focus has to be on keeping people well, having really good, active lives. They have good access to care in the community. Islanders remain in their own home if they choose to. So the model of care changes from that institutional care to going into care homes early, to having support that they need where they are in their home. And if it can't be provided in the home, that we make it as close as home as possible. I said earlier about that treatment in the right place at the right time. And in doing this, in keeping people out of hospital, we prevent infection, we prevent the spread of acquired illnesses, people remain healthier at home. But there's also benefits then to the services. So in providing that, we increase our preventative health services. We reduce attendances to emergency departments, and we're not talking about reducing appropriate attendances because we've got an emergency department and we're not reducing the department. It's just about having the right people in the department who need that level of treatment. We can reduce hospital admissions, and we increase that primary and intermediate care offer. We reduce the care home placements where that's appropriate and people choose to stay at home. We can reduce the number of people coming to the hospital for their outpatient appointments. We can make sure appointments are where they need to be. Reducing additional referrals and referrals on for things that aren't required, and we can repatriate. So there's care currently commissioned off of Jersey, but where appropriate we can bring that care back into Jersey and provide it locally. And in doing that, we reduce length of stays in hospitals, which in itself, the third benefit and the subsidiary benefit to all of this, if we get all of that right, we slow down the growth in costs in healthcare locally. So to bring all that to life, we want to think about what we're doing, what these new roles, what this new structure can deliver. So we just thought about some of the stories and things that we've heard about. So here's Esme. She's a lady that suffered, you can read this, mental health problems, has been in and out of hospital, sometimes detained because she hasn't been able to look after herself appropriately, so against her wishes having to come into hospital. But with our new model of care and with a home treatment team, she's been able to maintain in the community, access to support in the community, not needing to come into hospital, engaging with her in the community around medication, which previously she may have refused to take, and prevent that inpatient admission, which she didn't really want to have to happen without things happening against her wishes. She could be in control with the home treatment team. Another story is David, and David has got chronic obstructive pulmonary disease. He's on a multitude of medications, having all sorts of different treatments. He's having to live in a care home. And in 2019, he had 8 hospital admissions to intensive care unit because of his respiratory conditions. And you can see there, very, very costly service that we were providing to David. But with the new model of care, we switched to a community model where he saw the respiratory specialist nurse team in the community. He had a multidisciplinary team built around him, around his needs, so he could access different services, both provided by the hospital and by our external partners. And since January 2020, David hasn't required to come into hospital. So by changing the care and how he receives it and where he receives it, we've given him a better quality of life and reduced that need for the hospital services. And my final story, which I love, is Marjorie, who is now 103, but just before her 103rd birthday, she suffered a fall, injured her shoulder, injured her leg. Now, historically, she would have come into hospital and remained in hospital and then moved to a care home. But with our reablement services and our frailty services, and following her recovery, she received an individual package of care at home. She regained her independence. The reablement services went in over a 6-week period, a little bit longer, I think. She developed her strength. She gained confidence. She started to care for herself again. She fought many, many obstacles. But 9 weeks after her accident, she was living independently. And a lovely quote there that you can read, but they made her feel cared for from day one. So this is bringing to life what we're all trying to achieve by developing this Jersey care model over the next 5 years in Jersey. I'm going to hand you back to Anushka now to take you through the process.
Thank you, Jo. And just to confirm, these are real stories, aren't they?
Yes,
Jo?
they are.
Yeah. So these were real stories where basically projects were tried out in a different way, and they've shown so many good outcomes. So we want to build on these, and I think they are quite powerful, these stories, because they bring to life what we want want to achieve. So if you want to be part of that journey and our team, we would very much welcome your application. And as you see, we've done a little timeline, and it starts with the session today. Please do complete and submit your application online. You will have seen the links to it. It's on gov.ga, on the job site, or on our dedicated microsite. And what it is, it's an online form with some information. And then we would appreciate if you could just attach a CV and a short supporting statement summarising why you think you're the right person, what drives you, what you're passionate about, and why you want to do this role. Also, there is, we are aware that we have advertised quite a number of roles across grades. And what we were saying, for example, for the grade 10 roles, please just provide one application and tell us which post you might have a preference for, whereas at the moment the grade 12s are individual applications. However, if you feel you could do several grade 12 roles, please do indicate that on your supporting statement. And I think we are all right there if you don't do 5 applications, but actually do 1 and indicate that on your supporting statement in which roles you're interested in the grade 12 grade role. All right, and closing date is the 5th of April, that's Easter Monday. So we hope that if you start to do that during the week, please, by the 5th of April, Easter Monday, please submit your application. Then the shortlisting process will start. We will do that within our team, so people you would work with in the future are looking at the descriptions, at the applications, and we as a team will make decisions who will shortlist for each of the roles or grades, and we'll have a final decision made by the 12th of April. After that, our HR team will get in touch with those who have been successful and will invite them for interview. The interviews, as you can see, they are running probably between the 22nd and the 30th of April. So that's the period where we've blocked out dates, but we're not quite sure yet which job on which day, but if you could just keep that good week there in mind. And if you can't make any of the dates in these days, please indicate that on your supporting statement so we are aware of it. As you can see, what we will do, the interview will be a competency-based interview. So if you haven't done that before, please have a look what that means. Competency-based interview. Usually we would ask a number of questions around give us an example where you have dealt with difficult situation or difficult people, and then we would like to hear some examples from you around the context. What was the problem? What did you do? And what was the outcome? So try to be as prepared as possible for that. With these items for a number of stories you have and examples. We want to get to know you there. In addition, for the roles, you can see that there we would ask for a presentation or a task and an activity on the day. So the presentation will be a pre-task, so you will have time to prepare that, and the task activity will be done on the day. Once we have the interview, it will take a few days, but then by the 4th of May, hopefully we can provide feedback to all candidates on the outcomes, and that's not just those who have been successful, but also those who haven't been successful, and we're very happy to provide feedback on all of the interviews. I think that's all on the process. Again, if you have any questions, please do post them on the chat, and I can see we already have a couple there, which I'll have a look at in a moment. Just to say, we are quite a friendly team, a very positive team. You may have heard that. We're very open to new ideas. We are quite driven. We want to achieve things, so we're also quite challenging, where people in the service are not doing what we want them to do, but in a positive way. So we are here to represent the islanders and making sure they get the best service as possible. Right, let me have a look at the questions. So we have one here. Hello, are you able to provide contact details to discuss individual roles? A few questions about qualifications and salary. Yes, we could do that. Probably might be useful to do that on the generic email. So if you could send an email to the generic email you've requested to get this link for this presentation, which is hcsimprovement@gov.ge. Maybe we could just post that on the chat again so people have the email address, and if you just indicate which roles and what kind of questions you have, then we can make sure somebody gets in touch with you. 5-year residency requirement, yes, correct. So all of the roles, except as indicated, they need either you need to be born here, have 5 years residency, or are being married to someone who's got a license, so you're entitled to work. And all of the roles apart where it's indicated, they're all 5-year temporary roles because that's the length of the program. However, if somebody's interested internally, we also would look at secondment opportunities for 5 years, if that would be more attractive, because conscious that people want to look at job security. I think 5 years is a long time, can change during that time. Right, I'll just wait whether there are any other questions people want to ask. Otherwise, maybe we'll just switch on to Joe to just say hello, so people get a face to the name as well. There we go.
There we are. Hello.
So Joe is, yeah, Joe, you may just want to say your role in the directorate.
Yeah, so I'm the Associate Director of Improvement and Innovation, which is really exciting, having oversight of all the pieces of work, particularly interested in how we make sure that all of those teams in that structure join together to make sure we don't duplicate, but we enhance what each other's doing across the system.
Fantastic, thank you very much. Right, if there are, I don't think we had any more questions. If you do have any questions, do post them to the email address indicated, please. We are happy to get back to you. But then as a final one, thank you all for attending today. It's been great to have, we've had a lot of interest, but also a lot of roles, so I'm pleased that we had the opportunity to share a little bit around our directorate and the Jersey Care model, and I wish you all a lovely end of Friday and a wonderful weekend. Thank you. Bye-bye.
Bye.